Now, I will be demonstrating on how to obtain the oral temperature. Now, since I have lack of supplies, I will be using this as my patient. And then for the thermometer, I will be using a simple thermometer, which is the digital thermometer. In some cases, I should be using the electronic thermometer, but I do not have that at the moment. So before starting the procedure, you have to first perform hand hygiene. I will just be using a antiseptic or alcohol and perform hand hygiene. Now, when you have a patient, you have to help the patient to a comfortable and appropriate position. Now, to obtain the temperature reading correctly, you have to first get your digital thermometer and then make sure to clean from the tip to the bottom using an alcohol or any antiseptic wipes. Use clean gloves if appropriate. Now, you have to make sure that your digital thermometer is clean. Ask the patient to open their mouth and observe for any inflammatory process. If there is an inflammatory process, then consider getting the temperature from another route. Push the on-off button and place the thermometer tip under the tongue in posterior sublingual pocket to the center of the jaw. Ask the patient to hold the thermometer with their lips closed and to refrain from talking. Leave the thermometer tip in the place with until the audible signal which indicates the completion of the patient's temperature. It will appear on the digital display. So assuming that it has already rung, since I'm using a dummy, remove the thermometer's tip and note the temperature reading. So I will be assuming that I got 36.1 and then push the thermometer's on-off button and then again clean from the bottom until the tip and then return to the container. Next demonstration would be to obtain rectal temperature by using a electronic thermometer. Now, unfortunately, I do not have the necessary supply, but in actual setting, you will be using an electronic thermometer with a disposable probe since it will be inserted in the patient's anus. Now, for demonstration purposes, I will just be using my digital thermometer and I will be using my dummy as my patient. Now, to begin, always make sure to provide patient privacy by drawing the curtains or closing the patient's door. Have your patient assume a side-lying position or Sims's position with their upper leg flexed, exposed only anal area. Now, the anal area should be cleaned, so if there's any secretions or any feces, then make sure to clean it. Next is to keep the upper body and lower extremities covered with sheet or blanket to provide privacy and comfort for the patient. Now, remove the digital thermometer from the container, and then ideally you have to clean the tip with soap and water, especially if you're using a electronic probe. So for demonstration purposes, I will just be cleaning with an ordinary alcohol wipes. Next is to apply clean gloves and then clean the anal region. After cleaning, of course, your hands would be soiled, your gloves would be soiled, so you have to remove that soiled gloves and then perform hand hygiene and then reapply clean gloves. Now, assuming that I am using an electronic thermometer, squeeze a liberal amount of lubricant. And then, using your non-dominant hand, hold the thermometer, and then with your non-dominant hand, then spread the patient's buttocks and then expose the anus. Ask the patient to breathe slowly and then relax. Insert the thermometer into the anus in the direction of the umbilicus. Do not force the thermometer. Hold the thermometer probe in place until audible signal which indicates the completion and patient's temperature appear on the digital display. Now, since I am doing a dummy, I will be assuming that I got a result. I will be saying 37.3. Remove the thermometer's tip and then note the temperature reading. Push the thermometer's on-off button and clean by washing with soap and water. Return it in the container. And then clean the patient's anal area and then discard of all the items that you have used. Perform perineal hygiene as needed. So the next demonstration would be to obtain the axillary temperature using a digital thermometer. Provide the patient privacy and help the patient into a supine or sitting position. Remove any clothing from shoulder or arm. But since my patient is already wearing a tank top, then I'll just leave it be. Next is to remove the digital thermometer from the container. Clean the digital thermometer from the tip to the end using an antiseptic wipe. Next is to raise the patient's arm away from their torso and then inspect the skin for any skin lesions or cuts. Next is to dry the axilla or select an alternative site if there is an excessive perspiration. Insert the tip of the thermometer into the center of the axilla and place the arm across the patient's chest. Hold the thermometer probe in place until the sounds start. This is an audible signal which indicates the completion of the procedure. Remove the thermometer tip and note the temperature reading. So I got 35.4. So clean from the end to the tip. Push the thermometer's on-off button and then clean from the end to the tip using an antiseptic wipe, and then return to the container. Next procedure is to obtain the tympanic membrane temperature. So again, help the patient assume a comfortable position with their head turned away towards the side. Note if there is any cerumen on the patient's ear canal and obtain the temperature from the patient's right ear if the patient is right-handed, or vice versa. Now, since I do not have the tympanic thermometer, I will just be assuming using my temporal thermometer. So when you're using a tympanic thermometer, you have to insert the speculum into the ear canal per manufacturer instructions. In the adults, you have to pull the ear pinna backward and up and out. Fit the speculum tip snug in the canal, pointed towards the nose. Press the scan button on the handheld unit and then leave the speculum in place until this signal indicates the completion of the temperature. And then usually it would be in the digital display. So next is to just remove the speculum and then note the temperature reading and then push the ejection button on the handheld unit and discard the speculum. If the temperature is abnormal or second reading is necessary, replace the probe cover and wait 2 minutes before repeating in the same ear or in the other ear. The last step would just to be to return the handheld unit to the thermometer base. The procedure is to obtain the temporal temperature. Always ensure that the patient's forehead is dry. Place the sensor firmly on the patient's forehead and press the scan button until the sound is heard. Release the button and read the temperature, and I got 36.3. Clean the sensor with an alcohol swab and return to the storage unit. Please perform hand hygiene and then inform the patient of the temperature reading and then record. Help the patient into comfortable position. The next procedure is to assess the radial pulse. So first step is to first perform hand hygiene and then position your patient in a sitting position or supine. If the patient is in a supine position, place the patient's forearms straight alongside or across lower chest or the upper abdomen. If sitting, just bend the patient's elbow 90 degrees and support the lower arm. Place the tips of the first 2 or middle 3 fingers of the hand over the groove along the radial or thumb side of the patient's inner wrist. So that would be here. Slightly flex your wrist with the palm down until the strongest pulse was noted. Lightly compress the pulse against the radius, losing pulse initially, and relax the pressure so pulse became easily palpable. Determine the strength of the pulse. Note whether the thrust of the vessel against fingertips is bounding, full, increased, or strong, or expected, or barely palpable, or diminished, or absent. After palpating a regular pulse, look at the watch's second hand and begin to count rate. Count for 1 full minute and inform the patient of the pulse and record per agency policy. After palpating for a full minute, I got 67. The next procedure is to assess the apical pulse. Now, you have to first locate the anatomic landmarks to identify the point of the maximal impulse or the PMI. It is usually in the left center of the chest or below the nipple and just below the fifth intercostal space. Place the diaphragm of the stethoscope in the palm of the hand for 5 to 10 seconds. Next is to place the diaphragm of the stethoscope over the PMI. So first you have to expose the extremity. And auscultate for normal S1 and S2 heart sounds. After hearing the S1 and S2 with regularity, use the second hand of the watch and begin to count rate. Count for 1 full minute. Note the regularity of any dysrhythmia. Replace the patient's gown and bed linen and help the patient to a comfortable position. Inform the patient of the pulse and record per agency policy. Place the nurse call system in the accessible location within the patient's reach. Raise the side rails as appropriate and lower the bed to the lowest position possible. Dispose of all the supplies and then clean your diaphragm. Clean the earpieces, especially if you're going to share with other nurses. Then perform hand hygiene. Next is to assess respirations. Now, if your patient has been active, wait for 5 to 10 minutes before assessing respiration. Ensure that the patient is in a comfortable position, preferably sitting or lying with the head of the bed elevated to 45 to 60 degrees. If the rhythm is regular, count the number of respirations in 1 full minute. and then I got 40. If the rhythm is regular, count the number of the respirations in 1 full minute. Note the depth of the respirations by observing the degree of the chest wall movement while counting the rate. Assess depth by palpating chest wall excursion or auscultating posterior thorax after the rate has been counted. Describe the depth as shallow, normal, or deep. So as for my assessment, I got a normal depth. Note the rhythm of the ventilatory cycle and do not confuse sighting with abnormal rhythm. Replace the bed linen and patient's gown if needed and assist the patient to a comfortable position. Dispose of all contaminated supplies in the appropriate receptacle and remove and dispose of gloves and perform hand hygiene.